Welcome to The Whole View. I'm Stacy Toth of Real Everything, and I'm here each week to dive deeper into how we can find happiness and health inside and out through self-love, body positivity, and discovering new ways to be our best selves. Before we get started, a reminder that this podcast is for general educational purposes and not intended to diagnose, advise, or treat any physical or mental illness. And while Dr. Latifzai is
Yeah.
a medical doctor, he's not yours. So we always recommend that you see a licensed health professional accordingly. That said, I want to welcome you to the show. You are the co-founder of Rocky Mountain Regenerative Medicine. So we're going to be talking about what is regenerative medicine and different sort of aspects of it today. You're currently at a medical clinic in Boulder, Colorado. I'm a little bit of an internet stalker, so I loved kind of diving in and looking at kind of your overall career as a Dartmouth Medical School and Yale Emergency Medicine graduate and board certified in emergency medicine, member of the American Society of Interventional Pain Physicians, and specialty training in regenerative medicine. And you were born in Afghanistan, which is such an interesting, awesome story to emigrate to the United States, English not being your first language, and have come the way that you have in your career. And I see that plays out in the importance of how you approach quality of life, personal pursuits, and also giving back in how you practice. So while you have done everything from supporting the Denver Broncos in their sports pursuits and optimization, I also saw that you have helped impoverished areas in Africa with medical missions and different kinds of things like that. All amazing work and great. Since 2003, you've been practicing. So not new in this, but still make time for family and jujitsu. I love finding personal information. So very cool. Other than that sort of personal bio that we write about ourselves, what else can you share with listeners about yourself, your work, your passions?
Yeah. Thanks a lot for having me first and foremost. And you're right. You covered a lot. You did do a deep dive on my past history. I was born, like you said, in Afghanistan, moved to the US in 1990. Didn't speak a lot of English at the time, went to school, went to University of Missouri, and then afterwards got into med school and wanted to help people from a wellness, from a healthcare standpoint. And like a lot of people, regardless of their background, once you get on that hamster wheel, it keeps turning. And after med school, I went to Yale for training in emergency medicine. And after graduating, I moved to Colorado with my wife, Colleen, and I practiced emergency medicine for a number of years. And through that experience, I realized that this concept that I was to an extent on this hamster wheel that is called the American healthcare system. And there's certainly a lot of positives about it that really serves the types of needs that prompted me to go into healthcare. But in a lot of respects, the conventional healthcare system is letting down a lot of people. And one of the things that came to me pretty early is that in the realm of health optimization, it really didn't cater to patients in a way that was constructive. It was geared towards putting out fires rather than preventing them in the first place. So if someone injures themselves, then you do something about it. When someone develops diabetes or other diseases, then we cater to them. And even then, there's a big blame responsibility that's shifted to the patient as if the patient had a huge hand, had a huge role to play in that unfortunate disease process taking hold. And so that's not something that really appealed to me, that prompted me to look outside of where I was in the conventional healthcare setting. And about 7, maybe 8 years ago, we started this clinic, Rocky Mountain Regenerative Medicine in Boulder. And it was untested in a lot of ways. I certainly wasn't trained in starting my own practice in this way. So it took a little bit of a transition period. And we went through our usual ups and downs that I think a lot of entrepreneurs go through. And it was a learning experience. But ultimately, where I am today, where I'm working with the patients, the type of patients that I truly love, I gain a lot of inspiration from them. I work with individuals here at the clinic that also provide a lot of inspiration and make me happy and excited to wake up every morning and come to work. And so that's where we are currently. And it's been a wild journey, but I'm really content with it. So
I think it's a fascinating field that is definitely growing. And I think some people might not even know what regenerative medicine means. If maybe we could start there, what do you mean by when you say regenerative medicine? What does that encompass for you?
Yeah, that's an excellent question. As far as the general house of medicine is concerned, it's certainly the newest player, I would say. And the basic concept behind it is it's to empower one's own biology to heal itself rather than a heavy reliance on conventional pharmaceuticals, rather than a heavy reliance on the types of surgeries that ultimately are really invasive, really irreversible if something should go awry. It's less of a reliance on that and more of a dependence on biological solutions to empower one's, as I said, one's own biology to repair itself. So that's one component of it. And then the other component is this really hyper focus on optimizing one's wellness so that things don't break down, so that you can live the type of life that you were intended to, that you've envisioned. And so that's the basic concept behind it. But because it's so new, I think what oftentimes happens, as it did for me, is that it appeals to different physicians that have been formally trained in other areas of medicine, say orthopedic surgery or OBGYN or endocrinology. And so when they come to it, they're only seeing regenerative medicine through the lens of their training. And I think one of the things that I've certainly impressed on new individuals, new doctors who are coming to this field is to see the field for what it is and give it its proper due rather than just viewing it through their narrow lens. That's something that I was guilty of early on. Luckily, I was trained in a field that's pretty well rounded in emergency medicine. You have to know a little bit about everything into a sufficient enough depth where you can be pretty facile on your feet when a patient shows up to the ER. But if you're formally trained in orthopedics, you might not see things from an OBGYN standpoint. You might only be dealing with individuals who are young, who are predominantly male, and you're coming to regenerative medicine with that experience in the back of your mind. And so I really try to impress on physicians to look at regenerative medicine as a field unto itself. And sometimes it's a hard argument to make to some individuals.
I think that this is one of those areas of medicine that my science minded skeptic brain immediately goes to, like, it could be snake oil or it could be legitimate science backed information. And
Mhm.
so I love the idea of being a practice that your practice, specifically Rocky Mountain Regenerative Medicine, is focused specifically by two medical doctors doing the work and not, there are so many people who pitched a podcast that I hear about and all these things that claim to be doctors, but it's like chiropractic and not actual doctors. And so for me, when I'm thinking about some of the interventions that you're working on, like stem cell, that's something that I really want personally, someone who has been through medical school to fully understand the scope and impact on the body before making a really serious decision like that. And I noticed on your social media, you guys have worked with not just yourself at the Denver Broncos previously, but at Rocky Mountain, a CrossFit athlete who had an injury where she was considering or actually had scheduled surgery and ended up doing stem cell instead of and having recovery pretty quickly from that perspective. We did a very deep dive into stem cells on a prior show. Listeners, we'll put all the links in the show notes for you. But I am fascinated by this area of opportunity in the medical community and how it literally is regenerating your own body's healing. Can you talk a little bit about how that works? And specifically, like in this instance of the particular athlete you worked with, or if you have other examples,
Mhm.
I think it would be really interesting for people to think about regenerative medicine outside of just, some of the things that don't have as much science backed information behind them.
Yeah, absolutely. To your earlier point, there's certainly, you're right. There's probably certain players that have been attracted to this field of medicine And unfortunately, it's one of those terms, regenerative medicine or functional medicine, that's thrown around loosey-goosey with not a lot of backing. And individuals who, like you said, maybe they're not formally trained in medicine, maybe they're chiropractors. But look, at the end of the day, I'm not trained in chiropractic medicine. I really don't know um, what their training entails. Maybe it does entail a lot of the same stuff that we're doing. I really don't know. So I can't comment to that. I really, there's chiropractors that I've referred patients to. There are orthopedists that I've referred patients to, nutritionists who work with us, physical therapists. So I know that all of those individuals bring a different skill set to the table. And I know, just working locally through our local network of various types of providers, there's a level of comfort that I've achieved in referring those patients out where it's outside of my skill set. And I feel pretty comfortable working with those other individuals to supplement, to complement what I'm able to offer. So, but you're right in the sense that there are, and this was probably covered on the prior podcast, where individuals who are probably ill trained to perform stem cell therapy in a way that it should be done in, where then the results are not satisfactory, and it gives the entire field a black eye. And that's unfortunate, but it is what it is. That's the world we live in. We've worked with individuals from all walks of life, professional athletes, weekend warriors, and then everyday Joes and Janes. And I like working with all of them. I would say that by far, one of the patients who's really stood out in my mind is someone who's 80 years old, and she had a lot of spinal issues where her spinal curvature was a little unusual. And then, being that she was 80 years old and having worked really hard during the majority of her life, she sustained orthopedic injuries pertaining to her back. And ultimately, it culminated in her being really disabled, where it would take her several hours to get out of bed, and even in the activities and the pursuits that she wanted to do on a day-to-day basis with her grandkids, for instance. She was really severely physically limited. And she saw several different spinal surgeons. They all recommended a complete spinal fusion. And she's very witty, very smart. She does her own research. And she came to me saying, look, all these individuals are recommending surgery. I'm 80 years old. I really don't think I'm going to survive this surgery. And on a few occasions, I've asked these surgeons, would you recommend this to your own mother? And they flatly said no. And she said, look, my primary objective is to avoid surgery as much as possible. And what can you do for me? And unfortunately, that was a conversation where I said, look, the way that we do stem cell therapy is to harvest from that individual himself or herself, and then replicate those cells and reintroduce them back into the body at where the patient is ailing. And I said, ultimately, even though we're able to increase the number of your own cells, which naturally decline with age, I'm probably not going to be able to do a whole lot regarding their quality, which also deteriorates with aging, with time. And I don't have high hopes for this reversing your pathology. So I don't think it's going to work. And I would say, don't do it. I would say, see more surgeons and really consider all your options. But I don't think this is probably going to help you. I'm really selective about the type of patients who I work with. And ultimately, she insisted on undergoing stem cell therapy. We did it. And now she's a year out, and she still hasn't undergone surgery. And she's followed up with surgeons since that time, since her stem cell therapy. And really, there's no need for it currently. She's much more functional. She's able to get out of bed. She's standing up taller than she was before. And when I say that I gain a lot of inspiration from my own patients, I would place her towards the top. Have you worked with individuals, like I said, who are on our website and competitive athletes and whatnot? Yeah, that brings its own level of satisfaction. But ultimately, it's those types of patients who I've told that I'm probably not going to be able to help them. And after just a single injection of stem cells into her spine at the various levels where she had orthopedic issues, she's doing considerably better than she was. And so it's those little surprises that definitely stick with me more so than some of the other cases.
I think that's such a great example of the ways in which regenerative medicine can have the potential to improve our life, but also have kind of a realistic expectation of what we're talking about, and not that there's like this, I don't know, magic juice from Death Becomes Her, right? Where they, they like drink the serum and then they're instantly, everything about them physically changes and they live forever. Like it's not that, but it can have potential to help, and there is legitimate science behind the effectiveness. I think one of the other areas as I think about aging that I know your practice is sharing about and talking about is increasing protein. And I actually was really fascinated by this work that you focused on because as I was doing my internet stalking, I did find your published papers and found that there was one specific as it related to Alzheimer's disease. And I don't know if you're familiar with the work of Gabrielle Lyon, who wrote the book Forever Strong. She was on the podcast and focuses a lot on the importance of muscle as we age, because in her experience, she was seeing patients who she was realizing that the deterioration of aging, not your age itself, but like your biological age versus physical age, right, was vastly different in people who had muscle tone. And so her whole platform is building muscle, which I know you guys talk a lot about as well. And I just thought it was, first of all, fascinating how you guys have almost aligned um, history, experience, work experience, whatever, but also had come to a similar conclusion in the importance of building muscle and increasing protein as we age. Can you talk a little bit about where that philosophy comes from and how you implement it a little bit in your practice?
Yeah, I'm really glad you asked about that. The way I regard aging is it's no secret about what the most common causes of death are in the US and the Western world in general. And usually, the perennial number one there is cardiovascular disease, cancer is up there, metabolic disease, and all of its facets and consequences, its sequelae that stem from metabolic disease. That's up there. And also trauma. And the type of trauma that accounts for death of elderly, it's not what probably most people think about. It's not to fall down a flight of stairs. It's not getting hit by a car. It's certainly not gunshot injuries or other penetrating trauma. What it is, these low level falls. When I used to work in the ER, very frequently an individual will come in by ambulance who was maybe had dementia. Maybe they were at a nursing home and they mostly had a lot of their cognitive faculties about them, but they had sustained a low level fall. And it wasn't anything dramatic. Maybe the individual was bending down to pick something off the floor like a remote control for a television, and they lost their balance and fell over. They didn't have the strength to support them in that position. And just that low level, ground level fall resulted in a hip fracture. And some of your listeners may be aware of this, but hip fractures have a significant morbidity and mortality in the elderly. And it's unfortunate. And so certainly the way I regard longevity is we certainly want to backtrack if cardiovascular disease, for instance, is the number one killer. What are the risk factors that places one at risk for those types of eventualities? And then work backwards. What are the best tests to predict cardiovascular disease, to assess for those risk factors? And why are we not implementing those types of lab tests in everyday medicine? And there's a whole sort of a political and financial reason for that. And a lot of it, just to cut to the chase, has to do with the fact that the primary payer for medical services in this country are insurance companies. It's not the patient. And so a lot of times that relationship interferes with the relationship between a doctor and a patient. And it's not always in a good way. It interferes in a bad way. And so the way I regard longevity more broadly is to use the latest technology to assess for those types of risks. And then when it comes to your point, which is muscle health, strength, a lot of times we used to tell patients just exercise more. And then we used to give them very little guidance about the types of exercise. And then the question that occurred to me is, why are we not going a step beyond that? Like everybody's biological milieu is a little bit different from a hormonal standpoint, from a dietary standpoint. We really should be giving a complete set of instructions and a reason for why we're recommending what we're recommending. So if longevity is the objective, if living an optimized, fulfilled life, a capable life where you're independent of being reliant on your loved ones in your advanced years, how do you go about that? And so the process that we implement is looking at things through that lens with that goal in mind. So cardiovascular disease is up there. And the advice that we give certainly pertains to minimizing that risk. The same applies to metabolic disease. The same applies to cancer, dementia. And then, yeah, when it comes to exercise and building strength, we're really specific about the types of exercise, strength training, cardiovascular training, and then ultimately extending that to what those individuals should be eating. So if the objective is to minimize becoming the risk of becoming cachectic, becoming really weak in your advanced years, becoming osteoporotic in terms of your bone density. What should I be telling patients? And so when it comes to protein intake, I lean pretty hard on intake of protein because I don't think we're doing enough of it as Americans. And one really shouldn't wait until they're in their 60s, 70s, 80s before changing that. The earlier you change it, the more of a profound effect it's going to have down the line. And that goes both ways. If your protein intake isn't adequate, then you're going to suffer for it. And that effect is going to be amplified in your more advanced years. And if you really are diligent about your protein intake, strength training, cardiovascular training, then the same rule applies, but in a positive way, where you really position yourself optimally for avoiding a scenario where you fall from picking something off the ground and you break a hip. So that's the way that I regard longevity, and something I know you had a prior guest discussing stem cell, but look, stem cells fall under that same rubric. If that's one of the things that the stem cells are that repair and regenerate your tissue. And the older you become, the fewer stem cells you're going to have, the weaker, the smaller that reserve is. And so the capacity for injury, the possibility of injury is going to be increasing at the older you become. And so all of these things, yeah, when we discuss longevity and regenerative medicine in general, they really can't be regarded as individual compartments in to be addressed in a really narrow-sighted kind of fashion. We really take a holistic approach to health, and all of those different facets of health are equally important: cardiovascular disease, metabolic disease, cancer risk, et cetera, et cetera.
I love the simplicity of being able to focus on something like body weight exercises for building muscle and adding more protein, which is something accessible for most people to be able to do. I think there's a lot of supplements that can be sold around increasing all these different kinds of things, but really by efforts that I've made simply by stopping yo dieting to decrease muscle wasting, right? Like some of these kinds of things people don't realize that they're doing in their life to they think they're helping their health is actually reducing it. And I think of women like the woman that you were talking about is at 80 years old. I imagine this woman is a smaller, more frailer woman. I could be totally judging and assuming in my head, but I know that for the grandmothers in my life who like my grandmother went to water aerobics several times a week and had great muscle. And then she had knee replacements, had an issue, couldn't go back to water aerobics, and her health drastically deteriorated after that. And I think about that a lot as it relates to muscle, especially in women who have been told for so long to like be small, take up less space. And then they go into their later years without muscle, without this opportunity, having trying to lose the same 10, 20 pounds their whole life, muscle wasting in the process. And now they need that muscle and don't have it. And it's really difficult to build muscle in your later
Mhm.
years. So for me, when I'm thinking about women my age, I have teenagers, and I know a lot of the listeners here, whether they have young children, older children, or just in a later season of their life, it's making time for that self care to do the exercise and to make sure that you're getting adequate protein, adequate sleep, the things that our body really needs to be able to regenerate. Sleep is one of those things that I can't believe how inadequate our sleep is as Americans. And we talk about our health problems all the time. And I'm like, but all of us are chronically sleep deprived. That's a huge contributing factor to health.
Yeah, I think a product of just the pace of life. Sometimes you work yourself into a corner where you're working really hard and up at all odd hours of the night, and maybe you picked a job, maybe you're a little bit of a night owl, but you're being forced to work during the day, and it's just there's this disagreement between how you're programmed biologically and what you're actually doing. on a day-to-day basis where it's in conflict with one another. And look, I'm a victim of that too. When I was undergoing residency, unfortunately, you regarded yourself in a special way and also your colleagues in a special way if they could really do twice the amount of work and go through the night without sleeping. It was a badge of honor to wear. And I think that's the way that I think most people still regard it. And it's difficult to step outside of that paradigm and really care for yourself the way that you need to be cared for. And it's not a sign of weakness to focus on yourself, to do things like meditation. And it's not something that you necessarily need to spend a lot of money on. But as long as you have a commitment to focus on yourself, surround yourself with really good people who have your best interest in mind, I think it builds the type of life that you can get a lot of mileage just by how long you live, but also add to the quality of your life because you're a lot happier by putting yourself first, not in a selfish way, but in a way that demonstrates a love of oneself and a love of those around you. And you want to be around where you're able to care for those around you and not be just occupying their resources, requiring and needing their resources, and not giving a commensurate amount back to those individuals. And so, yeah, it's, I think, one of the products of just living in the world that we live in, where we measure success a certain way. And anything that's outside of that is interpreted as some form of failure. So look, I've been blessed to be in the practice that I'm in. I think oftentimes I think that I take away more from my patients than I give back to them. I love having conversations. It's not unusual for me to sit down with a patient for an hour, for 90 minutes. And half of that is me asking their advice. For me, it's like there's these friendships that build that's beyond just, hey, somebody is here for a 15-minute visit with knee pain and you address their knee pain and they're out the door. I think that's the value that I've obtained from working in the field that I've worked in. I just told you the story of this 80-year-old, and I'm sure she's satisfied in her own way with the result and her being able to avoid surgery altogether. But I have to say, like, I've gained a lot of satisfaction from her experience as well. So I appreciate it probably more so than she appreciates it. So.
I think it resonates with me a lot too, as someone who I have recovered from a back injury through physical therapy and different kinds of things as a prior competitive lifter. And now realizing after I've achieved all the things that I really wanted to achieve in life, professionally, competitively, athletic, all of these different things, and realizing like, and what did that do really? Like nothing. It just like deprived me of the sleep and the satisfaction of joy with my children, like time, like different kinds of things like that. And so I think, yes, it does take effort to step outside of that. But for me, it has been incredibly beneficial for my health to be able to do those things. And I think when I think of regenerative medicine and holistic kind of perspective on health and wellness, those kinds of things are really underutilized as an opportunity. And never once has my primary care physician said to me, "Oh, you're experiencing anxiety? Do you know that getting more sleep at night could help with that?" Which is totally backed by science on all those kinds of things. So I think also I would love to dive into some of the other areas in terms of what we can regenerate ourselves, but also augment in other areas. So, specifically, I'm thinking of, for example, exercise as being beneficial for a multitude of reasons in terms of hormone health and also the rejuvenation of something called NAD, which is something our body naturally does. And I'm going to do deep dive kind of part two for listeners on a lot of the scientific studies and the FDA stop sale and a whole bunch of weirdness around it. But there is legitimate science based on the fact that this is something that our body naturally makes. And there are things that we can do to boost production. And there are also supplements that you can take to boost production. But I would love to hear, because I know it's something that was on Rocky Mountain Social, like if you could just tell us what is this and how does it play into our body's health in so many different ways?
Yeah, yeah. Yeah, there are certain things that stem from aging. And unfortunately, just given the general trajectory of aging of time on our bodies, you can probably guess that with those sort of natural changes that occur, it's probably not going to have a beneficial effect on our bodies. I alluded to this earlier in passing when I said there's an age related decline in the quality and the quantity of one's own stem cells as one gets older. And sure enough, your capacity to repair, regenerate tissue, and move beyond injuries is hindered as a consequence of that. Well, another similar sort of thing that happens is what happens to NAD as we're getting older. NAD, which stands for nicotinamide adenine dinucleotide.
Thank
It's
you for being the one to say that because I never could have.
Yeah, it's a coenzyme. It's a key ingredient in all living cells, and it plays a role in a lot of biochemical processes throughout the body, including in cellular metabolism, how energy is released from nutrients and how your cells utilize that energy for repair and other mechanisms. So NAD is pretty crucial, and it's the amount that we naturally produce in the body. It declines as we're getting older. And it's certainly something that's associated again with aging. It is, I think oftentimes, I think what happens is maybe somebody specializes in offering NAD therapy and they pin everything on this decline. They pin aging in general on this decline in NAD. But the fact is, aging is multifactorial. It's not this concept of trying to pin everything on one problem and then having the solution in hand for that problem is not unusual. It's not just exclusive to NAD therapy. You know, for men, you'll notice on TV very frequently ads for different forms of medications that maybe blocks the production of certain hormones. And they'll say, this is how you address hair loss. Well, the fact is that form of hair loss accounts for a very small percentage of male pattern baldness. So sure, it wouldn't hurt to address that. But ultimately, pinning all male pattern baldness, attributing all of it to that one issue is probably an overreach. And I would say the same thing about NAD. Is it important? Absolutely. What's a testament to that? Well, the fact that all your cells need NAD. Is there an age-related decline to NAD? Absolutely. It decreases. But to then go a step further and say all aging is related to NAD therapy is going to reverse all of that. It's a tall order. I don't know if I buy into that. Again, I would stress sort of the importance of a holistic approach to anti-aging, to longevity, to healthcare in general, rather than pinning it all on NAD. But at the end of the day, does NAD hold a really central role in energy production, in cellular repair, in brain health? Yes, absolutely. By boosting NAD levels, it's quite likely that your cells are going to are going to have sufficient raw materials to do what they need to do. And sometimes with this decline that occurs in NAD production naturally in the body, um, you might have mechanisms for doing all those things, but those mechanisms aren't being run as efficiently as they would if NAD was present at a sufficient level in the body. And so that's where NAD therapy comes in. And a lot of times, NAD therapy is administered intravenously. We certainly do that at our clinic. There are oral forms of NAD, there are oral forms of precursors to NAD that one can tap into. Ultimately, as occurs with all orally taken medications, there's certain limitations to how effective it might be in topping off your required levels of NAD. And that's not a concept that's specific to NAD. It applies to a lot of medications. When you take a medication orally, in part, you're at the mercy of your absorption of that medication from the gut into the bloodstream. And that might vary. You and I might take the exact same dosage of a certain medication, including a supplement like NAD, and we might absorb totally different amounts. And then once that medication is taken orally, it's at the mercy of something that's referred to in pharmacology as first pass metabolism, which means once that medication or that supplement is absorbed from the gut into the bloodstream, one of the first stops that it's going to make is the liver. And the liver is going to treat it like a toxin. And it's going to try to get rid and eliminate and metabolize and process some of that medication or supplement. And so ultimately, what ends up at the ready to enter your cells where it can be used is a small percentage of what was ingested. And you compare that to, say, IV administration of NAD or IV administration of a medication, a lot of that hits the bloodstream at once. There's no guesswork as to how much is going to get absorbed from the gut. And then ultimately, sure, some of that will be processed in the liver as well, but the liver is not going to be the first stop that it makes necessarily. It's going to go to other parts of the body. And so all that to say that the bioavailability of a medication or a supplement like NAD is going to be much different if it's administered intravenously versus orally. So,
Super helpful. And the one question I would love to follow up on this beyond the research that I did are how you identify a person who this would be appropriate for. So specifically, what are risks associated with it and who is not a good candidate for considering NAD supplementation?
yeah, that's a really good question. So, first of all, none of us are, this supplement is not foreign to any of us. As I said before, our cells produce it. So, it's not like a medication is being introduced into your system that is completely novel. Your body hasn't encountered this particular supplement at all. And now it's a little bit of a guesswork as to whether you're going to mount an allergic reaction or what have you. That's not going to happen with NAD. Will it make you feel, can you have side effect? Absolutely, because you haven't encountered when you administer this product, NAD, intravenously, it's quite unlikely that you've encountered that much NAD in your bloodstream all at once. And you can certainly experience side effects. Nausea is a really common side effect. Muscle cramping, spasming is another side effect that occurs, but usually manage that by slowing down the drip rate of how quickly NAD is being introduced into the body. Sometimes patients will experience flushing or a rash that comes on, but ultimately these are not allergic reactions. And so, to the extent that I would be concerned as a clinician about the prospect of an allergic reaction, like if I was giving someone an antibiotic, penicillin for the first time intravenously, I would have a different level of concern there where maybe they can mount a true allergic reaction because they just haven't seen that molecule. It's totally novel for your biology. But when it comes to NAD, I have less of a concern there. Now, to your other question, there are certainly patients who are quite healthy and they're doing NAD therapy along with maybe other forms of therapies, and for those individuals, it's not a big deal to be introduced to NAD in this fashion. There's other patients though that might have quite a bit of pathology going on, meaning maybe they have liver failure, they have a condition called cirrhosis, maybe they have kidney failure, maybe they have other really advanced metabolic disease. And I would definitely be cautious in those individuals because although the same molecule is not going to be new to them, regarding how they process this supplement is it's going to be different. Earlier, I said that a lot of medications go to the liver for processing, for metabolism. A lot of these medications are then cleared entirely from the body by the kidneys. And so if you've got an individual who maybe has really advanced kidney disease, kidney failure, they have advanced cirrhosis, I would definitely be cautious. Can NAD do a lot of good in general? Absolutely. But if you've got some of these really advanced pathologies where the body is under a tremendous amount of strain and stress already, and maybe things are being held together in a really stressed manner, you just want to minimize how much additional stress you're introducing into that individual. So I'd definitely be more cautious in pursuing NAD therapy. Maybe if you go in for NAD therapy, initially take a low dose, maybe take oral doses at home. There are formulations of NAD that are sold over the counter. There's some precursors to NAD that are marketed, including something that's abbreviated NR or niacin, for instance, which is vitamin B3. I would probably do that as opposed to an NAD infusion. And look, at the end of the day, that's one of the downsides of some of these infusion centers that just cater to all patients who walk in through the door. In Colorado, I'm not sure what the rules are, around the country, but in Colorado at least, you might not even have a doctor on staff at the facility, and individuals are being given these supplements and other medications at a full-on dose without consideration of other comorbidities. And so all those things I would say are important, and you would need to proceed with caution if that's the case with you. So
I think that is such a good point about who's on staff and is what I meant earlier by chiropractic. Like I myself had scoliosis as a teenager, and a chiropractor changed my quality of life in a very positive way.
yeah,
But I also went to 2 chiropractors before that who were absolute quacks and gave me sunburn by putting me under a heat lamp. But
yeah,
my point is, if someone is putting a doctor in front of their name and is not a PhD or a medical doctor, I think that is beyond inappropriate. I think that's misleading and
yeah,
problematic from a medical perspective is what I meant earlier.
yeah,
And I think it's especially important in cases like this where you're talking about the potential to cause harm instead of help someone's body beyond just the things that you've mentioned. It also has the potential to increase cancer cells. Very preliminary work showing there. If you don't yet have cancer, it could help prevent it. But if you do have cancer, it actually could increase the tumor cells because you're generating cells so much that now you have extra and the cancer cells are going to grow. So to go see someone about this without getting like a full health history and just walk in and do it is like red flag for me. Like it has
yeah.
great benefit opportunity, but it's also like you need to work with a medical professional to ensure that you're getting the benefit from something that you want, right? Sometimes we want an outcome and we think that we know the answer and how to get there, but a medical professional needs to fill in the blank and ask a bunch of questions and say, actually, I have the experience and the education to point you on a different path to get there.
Yeah, this sort of bottom up approach, if you will, to healthcare. It's a double edged sword, right? Like on the one hand, I love it, this grassroots effort where it is, I think, pressuring providers in general to do their homework and not just give a one word, one sentence answer when a patient comes before them and they inquire about certain therapies. Like, hey, doc, what do you know about stem cell therapy? Does it apply to my specific situation? I think we're getting away, I hope, from a position where a doctor just says, "Hey, I don't know much about that, and you shouldn't do it," or "Hey, that's just a bunch of quackery. Don't engage in it." And there's not more of a substantive conversation around it. I think that's the good part of this grassroots effort. The reason I say it's a double-edged sword is that the downside is sometimes these therapies, whether it's NAD or something else, are marketed by individuals who are steeped in the business aspect of those therapies, and they want to leverage that, and not necessarily they're not as invested in the medical understanding of it. But if patients see those ads, whether it's on Instagram or elsewhere, they're going to respond to it the same way that they respond to pharmaceuticals. What do they see at the end of all the drug ads? Go talk to your doctor about it. And if you do your search and see if there's an NAD place near you that's offering it without consultation, without medical input, then you're at the mercy of whoever's staffing that facility. And you're right, they're not going to take into account a lot of the factors that they probably should be accounting for. And that's too bad. And so that's the double-edged sword of this grassroots effort. And hopefully at the end of it, we're going to see more good than bad. But yeah, I think it's really best to go to a place that has a medical doctor on staff that's able to sit down, talk to you about your goals, objectives, and then take all of that into consideration rather than just an a la carte approach where you're dictating what's being put in your body, but there's very superficial understanding as to why that those things are.
One last topic before we wrap up, as many of my listeners are women approaching perimenopause or already in it, or perhaps even in the throes of menopause. I don't know if you saw it, but there was a viral video on Instagram, TikTok from the Holderness family who makes kind of satirical videos. And it's the mom. And she says that a new person's entered their relationship and they mock perimenopause is in the relationship. And she goes through like all the symptoms that they're experiencing in their relationship. And um, Dr. Mary Claire, who's a menopause expert, was on our show, did like a show Instagram live with them to talk about some of these things. And with all of it seems like finally attention being given to women's health, perimenopause, menopause not being like words we no longer say out loud. it seems like there's some science coming out with the potential for improvement related to stem cells. And I would love if you could share a little bit of insight as to what the potential that some of these studies are looking at for ovarian stem cells to help women with fertility, delaying menopause, and some of these things. It's all still in vitro and things are not finalized in human trials, but
Mhm.
the science seems like it could be beneficial from that. And I know that you have a passion for stem cells.
Mhm.
Is this something that you're familiar with or have knowledge about what some of this potential could be?
Yeah, thanks for bringing that up. Unfortunately, in general, in conventional medicine, we don't have such a good track record of women's health for years and years. Even if you go to your OBGYN currently and inquire about HRT, hormone replacement therapy, it's not uncommon for them to be conflicted and bring to bear some of their personal experiences, anecdotal experiences, and not rely on purely on the scientific studies that are out there because I'm sure you're familiar with some element of the Women's Health Initiative study that was published several decades ago that was supposed to put this question to bed of how what are the risks of HRT in women? How beneficial could it be? And it turns out that particular study was fraught with a bunch of bias and a bunch of errors that didn't need to happen, and it was this huge effort that was undertaken for naught. Basically, it was a big waste of time. It didn't really the results that were published have then been picked apart and people have debated about how reliable that information is. And so right now, I think in large part, once women hit menopause or perimenopause, they're suffering with certain symptoms that are definitely palpable that they can feel, and it's not good. But there are other symptoms that they're having to live with completely unaware because that hormonal deficiency that results from aging can certainly contribute to one's risk of heart attacks, one's risk of stroke, one's risk of osteoporosis. And so none of those things can be sensed. And so even though the woman that may be experiencing hot flashes, maybe not, maybe they're lucky, but they're not seeking help for it and they're suffering silently. And that's really a big letdown as far as conventional medicine is concerned, that we're bringing a lot of personal bias into it instead of relying heavily on the science of it. With regards to the role of stem cells, look, whether I'm talking to a woman or a man, it's the one thing with regards to stem cell and aging that's been really borne out, study after study, is this age-related decline in the quality as well as the quantity of one's own stem cells. And there's been tons of animal experiments that have been done that prove the importance of stem cells. So, for example, there's been mice that have been taken and their stem cells in a part of the brain called the hypothalamus have been intentionally damaged. And within very short order, these young mice begin to exhibit signs of aging where their fur is falling out, their bones are becoming osteoporotic, they're experiencing muscle loss. They can't remember how to run through the maze as well as they did before. Their cardiovascular strength reserves decline. And then the researchers reintroduce stem cells to that part of the brain. And sure enough, all those effects start to reverse. We have other experiments in mice where you're taking individuals, you're damaging specific stem cells in their muscle called satellite cells, and then you intentionally cause an injury, and you compare that group of mice to individuals who have intact satellite cells, and sure enough, they're repairing and regenerating at two different paces. And those individuals who still have those mice who still have their stem cells about them that are functional, they're getting back to activity much faster. Their injuries are being repaired much faster. And so, whether you're talking about men or women, the bottom line is your stem cells are declining a couple of different ways as you're getting older. And it really would behoove you to address that on some level. As to what that portends for reproductive health, specifically IVF, I don't know the answer to that. And so I've certainly shied away from individuals who've come to me looking for help with regards to their in vitro fertilization. That's not my area of specialty. I would feel much more comfortable referring them to OBGYNs. And locally, I have really good relationships with OBGYNs that I would feel pretty comfortable referring those individuals to. But that's not something that I would feel comfortable addressing because I'm just simply not familiar with that science of it. And I don't want to be promising something that's far from true. So,
I think there's a lot to be said for knowing limitation.
Yeah,
And
yeah,
I get and appreciate that. I think from the perspective of someone who is approaching my wisdom years and having so many friends and people in my life who have experienced infertility, the idea that we might have the possibility of a solution with um, potentially stem cells or other kinds of things, learning how the toxins in our life are affecting our health, all that kind of stuff is great. You
yeah,
did have one recommendation
yeah.
that I would love for you to share as it relates to hormone replacement therapy. For those of us who are going in and requesting testing of our hormones with doctors,
Mhm.
do you have specific recommendations about when to go in our cycle? What are some of the things that we should be requesting be looked at? Some of the things that might eliminate blind spots or bias or some of the things you referenced?
Yeah, I tell women, look, whenever you start to experience signs of irregular menstrual cycles, maybe your cycles are becoming heavier in flow, or maybe it's going the other direction and they're becoming lighter, you're experiencing mood swings, hot flashes, like definitely go in, get checked out, get a full panel of labs. And it's really important to have built a relationship with a doctor beforehand where it's not you've done the homework already. You're working with someone who you feel comfortable with. You're working with someone that you've got a good feeling about what their values are and how those values pertain to your health in particular. I think what oftentimes happens that doesn't serve the patient very well is we wait until the last minute until we're starting to experience these symptoms. And then you go see a doctor that you sort of just pick out of the hat because they've got an opening, and you go in for a 15-minute visit and you come out of it less than thrilled, where your concerns are not being fully appreciated. They're not being fully met. And labs are being ordered that maybe, they're being ordered for everyone, carte blanche, without considering their specific situation. So that relationship with your physician, with your doctor, with your PA, whoever your care provider is really important. And then go in about a set of questions where maybe these are the risks that are really important for me to consider. And I need to discuss this with my physician, and then these are the benefits that I've read about, that I've talked to my friends about, that I have in mind for my wellness. Let me kind of balance this with the provider, discuss it, kind of balance the two and come up with a plan that you can implement. And so that would be my recommendation. But that relationship with the provider is really key. And it probably takes a little bit of time investment in determining the right fit for you. Ask your mother, your grandmother, if they're still around. Just inquire about what age they made that transition, because chances are, if you're going to share a significant portion of your genome with that individual, chances are you're probably going to cross that bridge at about the same point. And so if you get a good feel for that, I think that's information that the doctor would also value, where you say, like, look, these are the symptoms that I'm experiencing, and this is what I'm concerned about. Here's what people who've gone before me, the women who've come before me, have experienced it at about this age. Maybe that's lower than the average. Maybe that's higher. That age is higher than the average, but really express to them that information, and that relationship with the provider, with the right doctor, is so key.
I think for most people, we are um, willing to accept whatever kind of is in front of us. And oftentimes we think like our doctor is the boss of us and we don't take the authority to realize that, like, hey, we're paying this person for a service. If we don't like their service, we can find it elsewhere, and to make that connection that you're talking about.
Exactly. Exactly. I think it's really important to be an advocate for yourself, because if you're not going to advocate for yourself, then unfortunately others may not have the same impetus to do so. So
Like,
yeah. Yeah.
I always like to leave listeners with something positive and actionable that they can take away to be of service to work on either themselves or someone else so that they don't feel like, oh my gosh, I just heard all these things and I don't know where to start. What would be something, one or a few things that you would say to someone as soon as the show is done? Don't feel overwhelmed. Do this instead.
Yeah, that's a really good question. Look, I think oftentimes, because of the hustle and bustle of every day, there's not a plan to get through, maybe through the day, maybe through the year, maybe through the decade. But take a few moments, take a day to really sit down with your loved ones and map out where you want to be in the future. We all love to live to 100, live in a really healthy way. But it turns out there's a lot of things that occur along the way from a health standpoint that interfere with that, that has the potential to stray us off course. And if you have a really decent idea, if you've got a really good idea about what you want to be doing, if you're currently in your 40s, what you want to be doing when you're in your 60s, what you want to be doing when you're in your 80s and beyond, and work backwards from that and take into account a loss in strength or some unforeseen health event. How do you account for that in that age related decline in comparison to where you want to be going? So those are the types of thoughts that need to discuss with your loved ones and consider yourself before just going through life and aging just haphazardly. You do have control. Sometimes the interventions that you implement decades in advance to avert, say, a heart attack that has claimed the lives of several other loved ones who are older than you, who are a generation older than you, 2 generations older than you, doing something about that in the here and now, decade before something like that could potentially occur, is going to save you a lot of heartache. And it turns out it's going to be very undisruptive as far as your current life is concerned, provided you start early enough, you start accounting for that. So I guess my advice would be to slow down and really think about where you want to be headed in the future. Do it in concert with your loved ones, those individuals who are going to be around you in the future, and address that as early as possible. So I think that would be my departing thought there.
I love that. And as you were speaking, I was thinking like, yep, I'm really glad that past me quit smoking. Yep, I'm really glad that past me quit drinking alcohol. And I want to be able to be an active grandmother and travel. So I need to maintain my muscle mass so that I can do those things later. Like, yep, feel good. And of course, there's always things that we can wish that we were doing more of or better of or different. But I think being able to focus on what it is you want and be happy and focus on those things, I think also reduces stress and all of the other things that can have a negative effect on our health in different sort of ways. So thinking about what you want and taking steps towards that and also being happy and proud of the things that you've already done. Like I think that's not something that we give ourselves enough credit for,
Yeah.
right? Like all the things we at least for me personally, I always think about, oh, what I should be doing or what I should have done. And those are all like judgment negative words instead of thinking to myself, I am happy I did this and I want to do this in the future. So
Yeah.
love it and incorporates a lot of what we talk about here on the show. So
Yeah.
I thank you so much for being with us, Dr. Khoshal. I'm so sorry that it's difficult for me to remember, but glad that I got it. And listeners, if you want to check out more, you can head to Rocky Mountain Regenerative Medicine's website, rmrm.com. It's not difficult to find or remember. And I want to thank you so much for being on the show, sharing of your wisdom. I am going to do a kind of part 2 deep dive into NAD just
Yeah.
because
Yeah.
in preparing for the show, I went way overboard in my research and might as well share what I've learned with you listeners. So if you'd like to listen, check out the bonus show that will be released at the same time as this show. But so glad that we could cover all of the different kind of aspects. Well, even we didn't even touch on all of them, but some of the ways in which we can do regenerative medicine and appreciate that you're approaching it from a science minded, medically valid kind of approach. And thanks for all the work that you're doing for everyone. I love the story about the elderly woman. It makes me happy that she's doing well. I'll think of her in a very positive way, and I'm sure our listeners will as well. So thank
Thank you
you.
so much, Stacy. Thanks for
Yeah.
having me.
As I mentioned earlier, we've put a long list of resources into the show notes for you, including the other shows that I referenced earlier. If you want to listen to deep dives on stem cells or protein or some ketamine, some of the things that we've discussed. And of course, if you would like, you can head to patreon.com/the whole view to get all of our shows delivered to your inbox ad free, which is a great way to support the show that we create and produce ourselves. But even better, if you've enjoyed the show, could you let other potential listeners know? leave a review or recommend it to a friend. It costs you nothing except about 30 seconds, but makes a huge difference in my being able to continue to do this work. And don't forget to follow or subscribe in the podcast app, whatever one you're using. As always, we appreciate your willingness to be open to grow through your own personal changes. No one is perfect, but in listening, learning, and unlearning, we can choose to become better versions of ourselves for ourselves, our future selves, so to speak. As the doctor would say, thank you so much for being here today. And don't forget, part 2 was released today as well. I'm going to deep dive, get geeky on what in the world are NAD boosters and why did the FDA require a stop cell?